Lack of mental health care is one of the biggest public health crises of our time. And unfortunately, it's impacting overwhelmingly our precious children and young adults. At any given time, 1 in 5 of our kids is suffering from a diagnosable mental health disorder. In fact, mental illness is now one of the most common childhood diseases, and we have no vaccine. Half of us will experience a mental illness in our lifetime. 50% of the time, that will happen before we turn 14, before we even leave middle school. 75% of the time, that will happen before we turn 24, right in that sweet spot when we're transitioning from being a kid to becoming an adult. Most parents would rather cut off their own hand than let their child suffer. And yet millions of our kids are suffering alone because they and we lack information we need. As a result, only 1/3 of them are getting treatment. Many of those who remain untreated will suffer profound consequences through their lives. They will fail or drop out of school. They'll become addicted or involved in the juvenile justice system. They will flounder in finding their way as adults. But we have answers for these problems. We can address it through early intervention. We can provide access to mental health care beginning in our grade schools. We'll teach our kids, their parents, their teachers, and other staff working in schools how to recognize when a child is sick and how to get them help. We won't let children languish. They'll be identified and they'll be taken care of. We want our kids to have all the information and support they can get in order to be healthy and reach their potential in life. In order to give them this, we're going to have to get around 2 big barriers. The first is lack of access. Today, 1/4 of us have no mental health care providers in our health insurance network. And 56% of counties in the United States have no licensed mental health care providers at all. Now, what do you think can account for this lack of resources? I think it's our second big barrier, stigma. We are prisoners of stigma that developed thousands of years ago, long before modern science established indisputably that mental illness is the result of a complex interaction between genetics, the environment, and brain functioning. We are still influenced by fear and ignorance that caused us to treat the mentally ill in horrendous ways, like drilling holes in their skulls to let demons escape, and bloodletting to rebalance bodily humors, and locking them away in asylums to keep us safe from them. But this is the 21st century. We've decoded the human genome. We have brain imaging technology, yet stigma prevails. And parents are some of the worst propagators of continuing that stigma. Parents gossip about other parents' sick kids. They ascribe character flaws to kids who are sick, including their own. They'll tell their child not to play with another child because he or she gets moody. And parents keep secrets. When their own child is sick, they will refuse services at school and tell their child not to tell anyone about his or her diagnosis, that it's no one's business. Now, there is a real catch-22 for a child. So if Sarah suffers depression and her mother says she can't see the counselor at school or tell her friends or teachers that she's suffering, Sarah's mom is stigmatizing depression. And Sarah will self-stigmatize. This is common, likely worsening her depression. But stigma is just ignorance. And we can overcome lack of access and stigma. We can do this using early intervention. We can teach mental health literacy in our grade schools. I'm an early interventionist. Throughout my career, I have used early intervention and worked with programs that have provided early intervention to change the trajectory of people's lives. I'm also a mom. I have identical twin 20-year-old daughters. Because of my family's history, I knew that they would need support and information early to live their healthiest possible lives. We started talking about mental illness when they were 5 years old, and a friend started showing symptoms of depression. But I knew that we would also need to talk about OCD, schizophrenia, and bipolar disorder, just so that they could understand what was happening in our family. We've continued talking about mental health through the years, through their teenage years, and as they've gone on to college. One of my daughters, Grace, just before her senior year, started to struggle with her mood. She began to have episodes when she'd become suddenly very angry, irritable, sad, or even enraged. Grace kept many of these feelings private. When she went to college, her symptoms continued. In fact, the mood shifts had become disabling. Grace realized that she likely had a psychiatric disorder and started tracking her moods every day. Over time, she realized there was a clear pattern to her mood shifts, and she shared that information with me. And we got her to a psychiatrist. Grace began taking a mood-stabilizing medication. And by December of her sophomore year, she was diagnosed with a form of bipolar disorder. Because Grace was not impeded by stigma, and she was informed, she was able to recognize her own symptoms early and was treated, diagnosed, and in remission in a 2.5-year period. For most people, the gap between the onset of symptoms and treatment averages 8 to 10 years. So we can dramatically narrow that gap by teaching mental health literacy in our grade schools. Our grade schools can become mental health literate environments. We'll teach kids, parents, teachers, and other staff working in the schools about mental health, mental illnesses, signs and symptoms, and treatments. And we can provide access to treatment right there on site in the school, and referrals to professionals as needed. In a mental health literate school, kids will learn about their lungs and hearts and muscles and also their brains, but not just that their brains control the functions of their bodies, that they control their minds, their moods, their thoughts, and their feelings. Kids will also learn that we all have strengths and challenges, and in all kinds of areas like learning, motor skills, and even brain functioning. They'll learn that it's normal for brains to sometimes get sick, and that when they do, it will affect how they feel, how they think, and how they act. They'll learn language they can use to talk about mental health. And because mental health literate schools will teach that mental illness is normal, children will not develop stigma, and parents can let theirs go. Let's imagine what would happen in a mental health literate school when a 4th grader begins to struggle. Rachel recognizes that her friend Ben isn't acting like himself. He's not playing with his friends. He's sitting alone a lot. And she feels compassion for him. She doesn't tease or bully or reject him. Rachel embraces her friend. She's learned how to talk with a friend about mental health. And she knows she can take her friend to their teacher for more help. The teacher talks to Ben's parents, who are also mental health literate because they've learned this in the school. They're happy to take advantage of the resources at school and feel safe to share their own observations about Ben from home. And though they may be worried and even afraid for their son, they know they have the entire school community behind them. They're not alone. By teaching mental health literacy and giving these skills and knowledge to our children when they're young, they will take this with them into adolescence and early adulthood. And that's critical. This is a time when they continue to be at high risk. Because once kids move away from home, it's much harder to know what's going on in their lives, let alone their minds. My daughter described a night she and her friends spent in her dorm room scouring the DSM-5. That's the manual professionals use to diagnose mental illness. They were trying to understand more about what was happening to a friend that they were concerned about. They even contacted the University Wellness Center to get help. And they were told that unless their friend was already suicidal, the university could not do anything. They would not reach out to her. The friend would have to come to them. Last summer, I lost my 32-year-old nephew, Jim, to mental illness and suicide. Jim was raised by parents who were incredibly involved and loving. But when he was sick, he went to a friend who was not mental health literate. He told his friend he wanted to die. And his friend made him promise that he wouldn't hurt himself. He even invited Jim to stay with him until he felt better. But he didn't think to unload the handgun that Jim knew he kept right under the pillow on his bed. I wish I had a time machine and we could go back and save all those that we've lost or watched suffer. Tragically, we can't. But going forward, I invite you to advocate for mental health literacy in our grade schools and to develop your own mental health literacy. Eventually, we'll be a mental health literate society, all of us looking out for one another. There's no time to waste in stopping the scourge of untreated mental illness among our kids. Let's start now.